What's up, beautiful people? Another day, another study. One of the biggest failures I think I see out there when I'm working in conventional medicine is prediabetes is not being taken seriously enough by other clinicians and patients. Prediabetes increases the risk of many things that we see with diabetes, such as cardiovascular disease, early death, certain types of cancer, dementia, and it's a state that often precedes diabetes by decades, 10 years, 15 years or so. So it's something where doctors like me who really focus on prevention and risk analysis intervene heavily. I am bullish whenever I see someone who has prediabetes. I'm telling them about the risk. I'm really trying to prevent negative outcomes down the line. We know that lifestyle interventions are effective in preventing the conversion of prediabetes to diabetes and improving cardiovascular risk factors like hypertension, elevated blood lipids. There have been prevention studies that have looked at this, one out of China with a lifestyle intervention. Diet and exercise reduced cardiovascular mortality by 33% and all-cause mortality by 26% over a 30-year follow-up period, preventing the conversion of prediabetes to diabetes. However, other studies in different populations did not match these findings. This study reanalyzed data from that study in China, plus another similar study in the US, and looked at if you got diabetes remission in the first year, what happened as far as cardiovascular outcomes and all-cause mortality down the line. And the US study targeted a weight loss of about 7% and at least 150 minutes per week of moderate intensity physical activity as a lifestyle intervention. There was also a metformin versus placebo arm to that study as well. So in the US study, in the fully adjusted model, those who achieved remission at 1 year had a 53% lower risk of cardiovascular death or hospitalization for heart failure. For major adverse cardiovascular events and mortality, the fully adjusted risk reductions were 30% and 22% respectively. For patients who achieved remission at least once during the follow-up period, the reduction in cardiovascular death and heart failure hospitalization was 57%. And then they merged together the data from the US and China studies. When they pulled this data together, there was a 52% reduction in cardiovascular death and heart failure hospitalizations and a 37% reduction in all-cause mortality. Again, this is for prediabetes remission. Those who achieve a fasting glucose level of 97 milligrams per deciliter or less had a 37% reduction in cardiovascular death and heart failure hospitalizations and a 29% reduction in MACE. So a lot that we can take away from this. The key takeaways are prediabetes is very, very serious. Mitigating it can be done effectively with lifestyle interventions. And in fact, weight loss alone does not predict all of these effects. You saw in the people who achieve remission improvements in insulin sensitivity. This is something I measure in all my patients. We saw improvements in visceral fat. This is something I measure in all my patients. And you saw improvement in low-grade chronic inflammation. I measure inflammatory markers in all my patients. I use all this data to track how we're doing in remitting prediabetes. So key takeaway, take a diagnosis of prediabetes very, very seriously and start with those lifestyle changes to reduce your long-term risk of a lot of bad outcomes.